Hey everyone, welcome back to the show. It's your host, Dr. Joseph Kappas, and today I'm joined with Dr. George Gonzalez today of Quantum Neurology. Thank you for joining us today.
Absolutely. Thank you for having me. It's a good time.
Yeah, and this is the first time that we'll be touching on quantum neurology, so who better than you to discuss it, right?
Absolutely.
So before we get too heavily into quantum neurology, and we want to talk about the cranial nerves as well and how those two relate, can you tell us a little bit about yourself, how you got started into the healthcare field, where you practice, things like that?
Absolutely. So I went to Cleveland Chiropractic College in Los Angeles, graduated in 97, and then my wife had a moderate spinal cord injury while I was in my last term of chiropractic school. And, everything I learned in school wasn't able to deliver a successful recovery for my wife. And I took her to the doctors that I knew at the time of all different disciplines, chiropractors, acupuncturists, medical doctors, neurologists, anybody who would see us for free as students, right? Mm-hmm. So we didn't have any answers at that time. And then we booked an appointment with Dr. Mark Pick, who's an amazing neurology practitioner and SOT master, Sympathetic technique master. And we were on his waiting list. So finally my wife came in and he did a very thorough neuro exam on her. And at the time, it just seemed like, he just pulled on her fingers and he did a few reflexes, and then all of her deep tendon reflexes below the waist came back. So she was completely numb from her navel, her groin, her backside, the backs of her legs, and the bottoms of her feet. It's called a cauda equina injury. And for the people who aren't familiar with that. And so seeing her decline, and then all of a sudden have somebody do very simple corrections and see all those things recover, I just started crying. It was just like, what is this? Why is this such a big deal? And he said, well, it's neurology and you need to start training in it. And at that time in my life, I didn't have the time or the finances to do it. So I went to UCLA and I went into their bookstore and their library, and I went to the neurology section, and not even knowing what I was looking for, I just started pulling books off the shelf and just started reading and studying and looking into things. And, we prayed for my wife's recovery, and, God gave us this gift of quantum neurology. So I woke up one day and I had this ability and knowledge to do corrections, and I was able to duplicate them. And then, it was like unpacking a present. It took years to unravel the neurology of the nervous system and how to systematically evaluate and make corrections. And so it was about a 10-year process to develop the majority of what we teach in quantum neurology. And it's based on the simple premise of we're using the body's natural actions and reactions to achieve a desired result. Mm-hmm. And so we talk about the knee-jerk reflex. You tap the patellar tendon and the knee kicks out. Well, if somebody has difficulty extending their knee out, we could tap on that tendon to get the desired motion. So we're using the body's natural actions and reactions to achieve a desired result. And that's a simple example for everybody to understand, but it goes much more in depth in the layering of the neurology that we do. So a unique thing that we do in quantum neurology is we layer tests. So we will see, well, how does the body react to a simple strength test, myotome test. So we do the myotomes tests as a foundation of our evaluation, because that way we have an understanding where that patient is neurologically in that moment in time, right in front of us. And so, let's say we get somebody to what we call neutral, where we strengthen all of their myotomes and their cranial nerves to act upon when they're, to function when they're called upon. And that's what we call normal, right? That's what it should be. And unfortunately, most people we evaluate have some level of of drop off in those neurological functions. So we use our strategy to restore these functions to get person to neutral. And then we start playing with the layering of the nervous system. And what we consider the strength or tone of the nervous system is how many layers of neurology function are capable simultaneously.
Mhm.
So the idea is like, well, I could rub my belly, I could pat my head, I could hop on my foot, I could sing happy birthday, but there's going to be so many actions, then my nervous system is going to collapse, or it's going to break down under the pressure of so many, spinning plates, so to say, neurologically speaking. And so we have strategies of evaluating as well as strategies of correcting.
Mhm.
And so the foundation of what we do is traditional neurology, straight out of the textbook, with the exception of how to correct a nerve that is weak. We have a very simple methodology of correcting a weak nerve using manual or instruments like the activator type instrument, and which is like a little click thing for the people who may not be familiar with that. And then we use light therapy. I have my product here, the GRT light, and we use this as well. And we use this, we say, to stimulate the acupuncture meridians to reset the hologram of the body. And so the combination of the neurological testing, the physical correction, and the light therapy, that's how we make our corrections. And then it comes to the complexity, right? So the basic layer is the myotomes, which are the primary nerves that go to your nervous system. And there's very specific tests. There's 15 tests, myotome tests. And then every other test from that is a branch of those 15 tests. So we focus on the 15 myotome tests, and then there's 12 cranial nerves. And cranial nerves are the nerves that create our reality experience. Most people would call it our five senses: seeing, hearing, smelling, taste, and touch. Seeing, hearing, smelling, and taste occur on the head or inside of your head, and touch occurs in your entire body. So the sense of touch includes pain, hot and cold for temperature, light touch, deep touch, pressure, proprioception, and form recognition. Now, in quantum neurology, we have strategies to restore all of the things that we just discussed, all the myotome nerve level strength, the muscles strength also. We have the cranial nerve function that we're able to restore, as well as lost sensation can be restored. So these are all strategies that we've developed over this time, and we have a high level of success when it comes to rehabilitating people.
That's excellent. And I mean, you mentioned that this whole thing started because you were trying to help your wife, right?
Absolutely.
Which I think creates the most passionate practitioners that I've encountered, are the people who have such personal connections to what they do. And now you've taken this and extrapolated it so far and so complexly, and then made it simple for people as well. But your understanding is so complex and deep that you've been able to help so many different people. And you mentioned the 5 different layers, right? The first of which is the myotomal layer.
Right.
And then I don't know if I missed, but what then are the other 5? How do you then get to
Sure.
2, 3, 4?
So the main below the neck, right, is myotomes. That's the nerves, and the nerves go to muscle, tissue, organ, and bone. So from that foundation of the nerve level, then we look at the other tissues. And we have the 12 cranial nerves. So that'd be the second part there. And then and that's what we call getting somebody to neutral, is correcting their myotomes and cranial nerves. Then we go into sensory. So the 9 layers of sensation. And then we do visceral, so the organs of the body. And we do that through a concept we call nerve wires. So nerve wires, just like the electric wiring in your home, everything that is connected to one nerve, from its muscles on both sides, I'll say, and every tissue, organ, and bone that single nerve connects to, we refer to as a nerve wire. So if we have a weakness on one side, but especially on both sides, we consider the entire wire to be compromised. Just like in your house, right? If you can't turn on the blender, and then you're like, oh, let me check the fuse, but then, the microwave and the toaster and everything else isn't working, we know it's a bigger problem. It's the circuit that's off, right?
Mhm.
And we go to the circuit box and we trigger that switch to turn that circuit back on. Similarly, with quantum neurology, we're looking at the entire function of that nerve wire through its ends, through the muscular side of that nerve. And so we associate, well, if there's weakness on the muscular component of that nerve, especially on both ends, that's going to indicate that everything on that nerve wire is compromised. And so using that strategically, it's kind of like a Sudoku puzzle, if you're familiar with that puzzle that you play, and you just kind of find out, you trigger neurology in certain parts of the body and see, does that turn this back on? Or does it turn it off? And so like an electrician at the circuit box, we're triggering reflexes and muscles and different actions in the body to stimulate the function that's desired to turn back on.
Mhm.
So that's a simple explanation, I hope.
And then during your exam, I assume you're looking at all 5 parts, right?
Yeah, the fifth part is more advanced stacking.
Okay.
So the fifth part is stacking all of those together.
Mhm.
So I mentioned, the rubbing your head, patting your
Mhm.
belly type of idea. So once we have the foundation of the motor, the myotomes, the cranial nerves, the sensory, and the visceral, then we could stack all of those together to make a common correction. And we call that neuroexpression. So the idea of neuroexpression is, if a person were to step on a nail, it's going to affect the sensation of the bottom of the foot. But also there's going to be a muscular reflex, right? So it could exceed the threshold of that muscular reflex, and you could damage the S1 nerve. The bottom of the foot is S1. And, when somebody steps on a nail, they usually, there's some sort of expression, a yelp or something, but let's say they holler and their eyes bulge out, their pupils dilate. All those are cranial nerve events that are happening, right? So then we have we have the sensory, we have the muscular reflex, we have the cranial nerve event, we have the autonomic event, which would be chills up and down the spine, sweating throughout the body, those heart rate going up, those are autonomic events. But most interestingly, we have sexual organ dysfunction to bowel, bladder, and sexual actions, because it shares nerve supply with the bottom of the foot, of S1. So if we damage the bottom of the foot, step on that nail, we are affecting sensation, we're affecting muscle, skeletal, we're affecting cranial nerve, autonomics, and visceral organ functions. So, and very specific organ functions as well. So all this is mapped out neurologically speaking, and we can identify or trace the patterns of the injuries by, we get the patient to neutral first, and then we stimulate the injury, and then we can test all the neurology, and you can see what dropped off. And that's how we strategically strengthen somebody to their original injury. So we don't make them step on the nail again, but we would stimulate, a pokey thing on the bottom of the foot there, and then we could literally test out the neurology and see the neuroexpression. And that's what the fifth section is stacking it all together.
Okay. And then when it comes to, you kind of alluded to this, but when it comes to then the actual treatment of the patient, then do you have to kind of approach it? I think you said you want to get them to neutral by making sure step 1 and 2 are good. And then I assume, do you just go down the line then and make sure that everything else is back to normal?
After we get a patient to neutral, we determine what the needs of the patient are. If they have sensory problems, they don't feel their tissue properly, we're going to go into sensory. If they have organ issues, digestive upset or heart or otherwise, then we go into the visceral function. Or if they're an elite performer and they want to be at the top of their game, then we go into more advanced muscle skeletal work. And then cognitive skill as well. We have all the cranial nerve work that we do, that we really specialize in to expand the functionality of the cranial nerves. And so depending on where the patient really needs their help, we go in that direction. And then there's some people that need it all. So, the elite performers want everything. They want everything to the top level. as
Right.
I'm sure you've experienced as well.
Mhm.
You know, how you get those, business people, athletes, people who make their living off of their body being in top performance. Those
Mhm.
are the people that really get it. And, you know,
Yeah.
but we want to share this with everybody. We want everybody to know about it.
Right. Right.
Athletes tend to keep secrets. They don't want their competitors doing what they're doing.
Right. Um, so we wanted to talk mostly about cranial nerves today, right? So can
Right.
you dive maybe a little deeper then into the examination and then the treatment of those cranial nerves through the quantum
Absolutely.
neurology approach?
Sure. So, cranial nerves, for people who aren't familiar, are the nerves that come from the back of your brain, your brain stem, and they branch out around your head and innervate the functions or plug into the functions that we call our five senses. So, our seeing or vision is our eyes, cranial nerve 2, and then we have hearing for cranial nerve 8. Taste is cranial nerve 9 and 7, and also 10. And then we also have touch, which we mentioned earlier with the 9 layers of sensation.
Mhm.
And so that all comes from the cranial nerve. So that creates our reality experience. Anything we perceive as real comes in through these senses. And so if we have a drop off in one of those functions, and very simply, we could talk about hearing and vision. We know how devastating of a loss that could be for somebody. And people just don't consider the other ones as much, sense of smell, touch, and all that. But touch is a big deal. And those 9 layers of sensation have to be working all together to have what we would call normal sensation. When 1 or 2 or 3 of those drop off, the pain, temperature, vibration, and so on, then we have diminished sensation. And then when we lose all those communications, all 9 layers, we call that numbness. And so, real important aspect, and that's also very important for understanding for the cranial nerve function, because in addition to the cranial nerves, the actions of the nerves, we have the sensation of the entire head. Uh,
Mhm.
Eyes, teeth, ears, gums, tongue, everything is cranial nerve 5. So everything in the cranial nerve conversation, it's like a Rubik's cube. If you move one thing, you're affecting everything else. And so, the saying is the rising tide raises all ships. So we strengthen all the cranial nerves together so that there may be some connectivity that's off, as opposed to just saying somebody has a facial paralysis of the cranial nerve 7, and we only treat cranial nerve 7. That's
Mhm.
not our strategy. Our strategy is to strengthen all the nerves so that that facial area of cranial nerve 7 has full support from the other nerves for its healing. And then after we've strengthened everything, then we go in and specifically work on the specific nerve action of cranial nerve 7 for facial expression. So that's just a little introduction into the cranial nerves. But there's 12 cranial nerves, and each cranial nerve has a very specific function for the body. And there's sensory functions and there's motor functions, right? So the sensory has to do with feeling or reflexive reaction to something physical. And then we have the motor actions, which are the physical movements that happen after the reaction or that desired action. So these are 12 different areas. Cranial nerve 1 is their sense of smell. Cranial nerve 2 is vision. 3, 4, and 6 is eye movement. Cranial nerve 3 for accommodation. Cranial nerve 5 for muscles of mastication, as well as entire head sensation. Cranial nerve 7 for facial expression. 8 is for hearing. 9 and 10 is for speaking and swallowing. 11 is for the movement of the head and the shoulders. And 12 is for the movement of the tongue.
Mhm.
So it's impossible to separate an individual nerve. And I always talk about the tongue because the tongue has 5 different nerves acting on it. That small little piece of tissue has 5 different actions. So you have the sensation of the tongue is cranial nerve 5 for the anterior 2/3, cranial nerve 10 for the posterior. Taste, anterior 2/3 is cranial nerve 7, posterior is 9. And then we have cranial nerve 12 for the movement of the tongue. So it's 5 different nerves working on that piece of tissue. So just by talking, the movement of my tongue is affecting everything else that's there. The sensation, the taste, the all these things are working simultaneously. But when we're testing somebody, we isolate the specific action as much as possible because it's impossible to truly isolate a nerve. So we do that, and on the basic layers, we're testing the functionality. Can this person perform when called upon those actions? And then after we get that to neutral, then we start doing more advanced work. We start combining nerve functions. So real commonly, cranial nerve 3 for accommodation, which is responsible for our ability to focus on something, looking near at a target, looking farther away and back. There's a lot of things going on there. When just that simple action, there's a lot of things going on neurologically. And we stack that with cranial nerve 10 for speaking and swallowing. And so when we do those together, we make a correction. Usually, I can't say always, I can't promise or guarantee, but if this is the person's issue, usually any headaches, migraines, or those kind of symptoms are alleviated. And we can imagine, somebody is reading on their phone, they're scrolling, and all these actions get fatigued, and then they're going to complain of eye strain or headaches or symptoms associated to that. So resetting the nervous system and letting it be able to do these combinations of actions without breaking down. Mm-hmm. So that's strengthening the nervous system layering. Mm-hmm. And that's what we do, is we start checking these combinations, and as people get stronger and stronger, I say they become superhuman, because no one has ever been trained to the level of layering and complexity that we're able to get people to very, very quickly and simply as well. It's a process that once you learn it, you could really start getting creative with it. And people from the doctor care community who have trained quantum neurology, they have so much knowledge of neurology already, and just learning how to apply it in this methodology is a game changer, because things that are knowledge based now have an application, now have a way to be used on the body. And so we say that quantum neurology, we only train experts. We train doctors that have a lot of experience in all the different areas, whether it's technique or neurology or biochemistry or what have you. And then they use the neurology, I won't say for the Carrick students, but they get neurology as a framework behind their knowledge. Mm-hmm. And now they could really elevate what they're doing with the background of neurology behind it.
Mm-hmm. Yeah, and that's great that you're able to bring that all together and pair it all and provide that that additional treatment application to these practitioners so that they can ultimately bring it to their patients.
It's really cool because we're, in quantum neurology, we teach all disciplines, chiropractors, acupuncturists, naturopaths, medical doctors, and so on. And it's really cool to see all the different professions being able to incorporate it in what they're doing and see great results.
Mm-hmm. During your examination process, we talked about all the things that the cranial nerves do. When you're actually testing for them, what do the tests look like? Are they your pretty typical cranial nerve exam? And then what else might you be looking for that maybe someone else might not?
The uniqueness of quantum neurology, as I mentioned, is the stacking of tests. Mm-hmm. So we combine in the cranial nerve section and other sections of the training, we combine a myotome test with a cranial nerve test. Mm-hmm. And so the easiest one to do is C5, the deltoid, and we'll position the arm in different positions. And then we combine that with the cranial nerve. Mm-hmm. And we see, okay, well, they could do the muscle tests, nerve test under no stress, that's fine. They may be able to smell the T that you're using to stimulate the sense of smell, but when you do them simultaneously, they can't do it. So if they're smelling something and then you test at the same time, there's a collapse. Mm-hmm. So that's the idea, like there's too much spinning plates, so to say, and the system falls down. And we stimulate the sense of smell, and we use the light therapy, and we use the GV16 right at the base of the occiput there, and that's about 5 seconds. Will reset the neurology of that function. And I can't promise it's 100%, but we do see this all the time. So if it doesn't correct in 5 to 10 seconds, there's something more advanced that's wrong. But I would say a high level of the times we see the corrections in that time frame for each action. And then we would check neural nerve 3 for accommodation. So we would do the deltoid test by looking near, looking far, looking near. And if it breaks down, then we exercise the nerve specific action and stimulate with the light therapy. And then we'll see a reset happen within a few seconds. So, and also we usually see functionality improve immediately. So when somebody is doing the accommodation for near, far, near, we're testing them. At first, they're going to be very slow to look near and then slow to look far. But as they start strengthening the specific action, it goes faster and faster and more efficient. So the whole idea is to make the nervous system efficient. And in that efficiency, it's able to do more functions.
Right. And I think one of my favorite things about applied kinesiology is that they tend to challenge different things, right? And it sounds like you're taking maybe a similar concept, correct me if I'm wrong, and you're taking this concept of challenging the nervous system so that you can see, okay, where else do things break down and how can we then provide an appropriate intervention to make those things stronger. Is that fair to say?
Absolutely. Yeah. So I describe it as a blind person looking for the door. You know, we're pressing against the functionality of the nervous system, and then all of a sudden, whoop, oh, it collapses. And so, you know, we're looking for the boundaries of neurological function. And then when there's a breakdown in the test, whether it could be in the arm or the actual test itself could not function, that's where we know, okay, there's a problem here. This is where the issue is, and it's not a guess. This is the body cannot do this action, right? And then we do the correction, and more often than not, the correction restores the function, and then they have fullness of action on that area. And there are layers of neurological correction. So, you know, we have as we mentioned, the myotome layer. We have what we call the GPOI, Gonzalez point of interruption. We also call it the holographic layer of the nervous system. And then we start stacking neurological actions on top of that. Parasympathetics, we stimulate, you know, the toes, the pelvic floor, and we tickle and vocalize the palate. And the reason we do that is we want to add parasympathetic stress. Now, for those people that aren't familiar with parasympathetic stress, parasympathetic and sympathetic are referred to as the gas and the brakes of the nervous system, just to keep the concept simple. And if we're stuck on the gas, we're not going to be able to do the things on the brake side of the nervous system. So the gas side is fight, run away, and survival. The brake side of the nervous system, the parasympathetic, is rest, digest, and healing actions. So if a patient is stuck in sympathetic, they're not able to access their rest, digest, and heal actions. So in addition to correcting the neurological areas, then we add the layers of parasympathetic action, toes, pelvic floor, tickling the palate, and vocalizing. So it's, you know, toes, pelvic floor, and I say young. And that together as a stack on top of the correction will allow us to see, can the person heal after the wires have been connected again, right? So we add the parasympathetic, the rest, digest, and healing actions on top to make sure that that person can function with all those things going on. And in our mind, that means that there's a deeper ability to heal that's available compared to not having those connections functioning simultaneously.
And that's definitely something we see a ton of, as well as just this disconnect between the parasympathetic and sympathetic. So yeah, managing that, you can help a lot of people with a wide variety of symptomatology, which actually brings me into my next question, and that if someone's listening to this and they're really interested in what we're talking about, you know, I guess, how would somebody know that they would be a good candidate for quantum neurology care? You know, what should they? Yeah,
Anyone with the nervous system, really,
yeah.
and anybody with a brain, a spinal cord, and nerves that goes to muscle, tissue, organ, and bones. We've mapped out the nervous system, and we could identify the specific areas that are not performing as they should, and we have strategies to rehabilitate them to proper function. So, we say we work on old ladies to athletes, right? So, and everything in between, because everybody needs a stronger nervous system. Uh, Regardless of what somebody's dealing with, they're gonna get a better outcome if their neurology or their nervous system is intact and performing at a higher level than if they stay at a compromised level across the board, whatever we're talking about. And so with that concept in mind, anyone could benefit from neurological rehabilitation. We can't make a promise or guarantee of outcome. The only way to truly know is to go in and have neurological rehabilitation done and see how your body responds.
Mm-hmm.
So that's the true thing about that. Is ultimately, we could talk about research and we could talk about ideas. People tend to forget that there's the other side of the coin on the research. Everybody assumes, oh, I'm on the good side, right? If you apply that, you need to have the understanding of how to help the patient that's sitting right in front of you. And at that moment in time, you don't have time to, you may have time, but you don't really want to be looking up research and saying, how can I help this person? I want to use their, what we call innate intelligence in chiropractic. I want to use their innate intelligence to demonstrate the weaknesses that need to be strengthened.
Mm-hmm.
And it's different than me just going, this person has this problem and this problem, this problem. That doesn't do anything for the patient directly. If we're physically testing the patient and we're looking for the specific action to get the reaction of this function to turn back on, that's the win.
Mm-hmm.
It's, yes, we're smart and we have concepts of how to help people, but we have to listen to the patient's body and let the patient's body guide us to the win. Mm-hmm. And that's why we use this strategy. So we let the through the strengthened myotones and cranial nerves, from there we can really play with the idea of what stimulation is going to bring this patient further in their care. So that's the idea.
Yeah, and I think a concept that we stick pretty closely to is, every brain is different, every patient is different. So if you're able to learn as much as you can from the textbooks, from training, but then also be able to meet your patient where they are and to try to marry those two and to figure out what's best for them and their particular situation. That's where the art comes in.
It definitely is an art, as we were taught in school. It's an art and a science. Mm-hmm. And we have to take all that knowledge that we have and then be able to deliver it in a functional way that benefits your patient as well as yourself and how you do things. And it's, that's what we've been doing for the last 20 years, and teaching these strategies for doctors around the world, and getting amazing results in the process. It's a wild thing to be able to have something and then share it with other people, and then they can run off with it and their whole career and help people with it their whole career. It's a beautiful thing.
And that must be so rewarding that you were able to kind of conceptualize this and then teach that to so many other people who are now able to then touch the lives and better the lives of so many thousands, millions of people across the world. So that's such a cool feeling, I'm sure.
And the wild thing about that is, when my wife was damaged, we couldn't see the future. We couldn't see what was coming. And the beauty of it is, now it's just a story where in the moment it was like, you couldn't handle it. And, mm-hmm. I give the glory to God for giving us this talent and being able to share it with the world.
Yeah. Well, your patients and your students' patients, I'm sure, thank you. Which we're about out of time, so I want to make sure that we ask this final very important question. But how would then patients, practitioners find out more about you, about quantum neurology, how to get in touch, and then maybe find a practitioner near them?
Absolutely. I'll start with quantumneurology.com. You could, for doctors especially, but we have a doctor locator there. But the easiest way to probably to get through is through Instagram. My handle is at Dr. George Gonzalez DC. And you can also go to at Quantum Neurology on Instagram and go to the link in the bio. It's the same links. And then you can find out our offerings there and find a doctor near you, schedule an appointment, all the other things that are on there as well.
All the good stuff. Yeah. Well, Dr. Gonzalez, this has been fantastic. It's been fascinating. I know I learned a lot. I'm sure our listeners learned a lot. So I want to thank you again for being on and representing quantum neurology and enlightening us today.
Absolutely. Thank you so much. It's an honor to be here and love being a part of this community. So thank you so much.
Of course. And then this has been your host from the Neuro Wellness Podcast. Be well.